Mildura.
Thank you, Acting Speaker. Now, I wish it was my pleasure to speak to the take note motion of the 23-24 budget papers, but alas, this one hits hard, especially for those in rural and regional Victoria. It's hard. I've only got a few minutes, so let's talk about the most important thing that comes across my desk every single day, and that is healthcare. In particular, the Mildura-based public hospital. Yes, it is now public. And now what? We don't have a master plan. This budget hits hard for anyone who gets sick or injured in the Sunraysia region, which has been the Mildura-based public hospital, though back in public hands, has been completely ignored by the Andrews Labor government since being returned. If you get injured, however, on Saturdays, the private sector, one of our brilliant GPs, Dr Travis Taggart, has taken the initiative to run injury clinics so that people, when they get injured on a Saturday, which inevitably happens with football, netball, hockey, whatever it is, he is there through private funding, supported by the league, supported by Ryan Legal, to make sure that people that do get injured can actually be seen that day and then referred to the proper care on Monday, so they don't have to wait for up to 30 hours in the ED. It hits hard. The Mildura-based public hospital has been ignored by the Andrews Labor government through the election campaign when we committed $750 million to a new hospital. It was ignored in this budget, and now the public are being blatantly ignored by the lack of a master plan available to the public. Instead, it's been deemed as an internal working document, despite me asking for it several times in this place, and my predecessor also asking for the master plan. But no, it's a public hospital. We'll keep those documents and the plan private. We'll keep it to ourselves. What indeed are they hiding? It is a public hospital now that they bang on about all the time, so what exactly are they hiding? It should be public for everyone to see exactly where we're going, exactly what the plan is. They have been screaming out for years for 30 additional ED beds, drastically needed, particularly when you're waiting for 30 hours in the ED to be seen, sometimes having to be treated in a hallway or in the waiting room or wherever we can find space. Our region is bursting at the seams. We have already outgrown the hospital and desperately need a new one, and hopefully we were very optimistic that the master plan would pave the way and would show us what the plan is. They've promised, the previous health minister promised that there would be a master plan due in this year. That was over 12 months ago, and yet the Mildura community and the wider Sunraysia region are still waiting. No such luck. I've in fact even I've invited the health minister to Mildura to present this master plan to the public in a public hospital so that we could all see. And she did come to Mildura, in fact. She came last week to announce $14 million for medical records upgrading. $14 million. Now, coming from a digital background, $14 million. Medical records are important, obviously, but who's having a lend of who? We are out of patience.
Order. I'm required under sessional orders to interrupt business now, and the member may continue their speech when the matter is next before the House.
Thank you, Deputy Speaker. It's nice to rise again in reply to the budget take note motion. I've said previously that this budget is one that really hits Victorians hard, especially those in regional and rural Victoria. With the new and increased taxes, honestly, is it any wonder the cost of living is getting out of control and putting pressure on Victorian families? The jobs tax, holiday tax, health tax, school tax, land tax. This budget is hitting Victorian families hard. It hits hard for mum and dad investors who mostly only own one additional property. One additional to the one they currently live in. They make up 80% of the rental market. And those savvy investors might be paving the way to their own retirement or to their kids' education or just good future planning. It's a solid investment. We talk about a housing crisis and a rental crisis. Of course there is, when investors like these are jumping ship at an alarming rate of knots from the long-term rental market because it's all got too hard. So let's add a land tax. Let's make sure that small investors want to get out of the market and take those rental properties with them. What this budget should have done to tackle the rental crisis is incentivise landlords to keep those property on the long-term rental market, but it's done quite the opposite. This budget also hits hard for anyone who gets sick or injured in the Sunraysia region with the Mildura-based public hospital, which I've spoken about already a couple of times in this place, ignored by the Andrews Labor government since being returned to public hands. It was ignored in the election campaign, ignored in the budget, and now the public are being ignored with the hiding of the master plan. Now, it also hits hard for GP clinics who, despite what the government is saying, are now being hit with a health tax. And I've been talking to my GP this morning to get some clarity around this in simple terms. And it didn't take much for him to go on a bit of a rant about this and has sent me some articles from Doctors News. It's putting pressure on GPs by putting them in the crosshairs over this payroll tax. Now, let's explain it like they did in Doctors News. They said they lay out factors that determine whether GPs are treated as employees rather than contractors for tax purposes, including leave entitlements, rostering, and whether a GP can work in other practices. Now, given that our GPs are running the priority primary care clinic from 3 different clinics, that could affect that service as well. It's an absolute joke. So it's putting more and more pressure on our GPs at a time when we can least afford it. Now, this particular doctor says, and I quote, that other states are doing what they can to protect GP clinics, not Victoria. He also says, and I will read from the conversations that I've had, stressful topics like payroll tax, auditing, legislation associated with the same, all of these topics are adding more stress and pressure to already overworked rural GPs and takes time away from what they do best, seeing patients. Straight from the words of a GP literally 10 minutes ago. Deputy Speaker, this budget also hits hard for those of us that drive out on crumbling potholed roads each and every day with our families in the car and our children having to dodge trucks that are only getting bigger and bigger. Meanwhile, the roads are crumbling further and further and getting narrower and more narrow. And I've said it before, we don't drive on the left side of the road in Victoria anymore. We drive on what's left of the road, because that is quite literally true. That is what's going on. Less money for road resurfacing and the road maintenance. So that old saying has never been more true. It also hits hard if you are one of our magnificent CFA volunteers. And I want to send a shout out to our amazing CFA volunteers who do a wonderful job. They do feel like, again, I have been talking to some local CFA members and they feel like they have had the absolute soul ripped out of the organisation, who struggle to even get a bottle of water whilst they're out fighting fires. But they understand that the CFA is the backbone of small communities. We couldn't be without them because that's all we've got in small towns. And sometimes, some of the towns that you drive through in my electorate, that's all that's there. Annuello, for example, that's all that's left, the CFA station. And we need these volunteers. We should be looking after them. So I do want to send a big shout out to our CFA volunteers coming into what experts and scientists tell us is going to be our most dangerous fire season ever. And member for Gippsland East spoke about that yesterday, and it was fascinating, the science behind the fuel loads and how scientists are telling us it is going to be a terrible summer and we will burn again. So my thoughts are with already the CFA volunteers. It also hits hard for businesses who have been battling work cover premium increases, payroll tax and other cash-grabbing exercises that this government throws at small business time after time after time. And I know this from being a small business owner previous to this role for the past 12 years and how hard it got to the point where you literally felt like throwing in the towel. You know, after COVID, floods, and the battle it is every day to run a business in Victoria, they keep getting slogged again. Rural and regional Victorians are among the most resilient people on earth, but there is only so much we can take. Now, when you think about the history of the Mallee and the Milawa, the Wimmera, and how people like my great-grandfather, my grandfather, settled and farmed there before technology, without water, without connection to the river, it was some of the harshest, driest country in Australia, and they literally got on the train and jumped off in the middle of the desert. It was hard, but they fought through it, and now we have some of the most innovative farmers in the country, both in dryland and in horticulture, producing the food that every single person in here eats every single day without giving those people a second thought. Dryland farming innovation is largely led by GRDC and the Birchip Cropping Group in our region, who I was lucky enough to be out in the field with a couple of weeks ago. But they too need more investment. Their next flagship project that the Nationals had committed to during the election is the Nexus project, which will not only build accommodation suites for professionals, teaching staff and researchers, but a state-of-the-art lab space so we can keep innovating in this space because it is vitally important. My point is that country people are full of fight. And I've said this in this place before. We are full of fight, and I'll say it again because it's true. We're full of fight and we will keep fighting. We haven't got a choice, although up on the border there is actually a choice, and people are, we see it every day, taking their businesses, their homes over the river, where life is just a little bit easier, and it's very, very easy for them to do so because it's literally a 5-minute drive. But we will keep fighting for our right to live our life the way we want, not the way this government dictates that we should. And that is how regional and rural Victorians are feeling right now. We're full of fight because it's in our blood. Against all odds, fighting and surviving, not only surviving but thriving, is in our blood, just like those that settled the Mallee in the first place. This budget really is one that makes it clear that this government doesn't actually want you to own anything. They want you to own nothing and be happy with that. Well, we're not happy with that. We've worked too hard for too long now to throw in the towel.